options that women have after having a mastectomy is breast reconstruction. Breast reconstruction has really evolved over the last 10 or 15 years. We are now able to reconstruct a breast that is almost as good as the natural breast, and we can do this with implants, we can do this with your own tissues, and we can do this with the tissue rearrangement techniques. Now, it's important to remember that it won't be exactly like the old breast. There will be some subtle differences. And those differences may be that the contour is slightly different, the volume is slightly different. You may not have the same sensation that you had prior to a mastectomy. But the good thing is that the new shape, the new contour is still very appealing, it's still very attractive, and I think that it really does mimic what a breast should look like. Breast reconstruction can really be performed in a couple of different settings. It can be performed immediately at the time of the mastectomy, or it can be performed on a delayed basis. That is, after the mastectomy has been performed and after all of your treatments have been completed, you can come back and get a reconstruction after it's all done. Now, the decision as to whether to do this immediate or delayed is going to be based on several factors. Some of them are related to the breast cancer itself, and others will be whether or not adjuvant treatments are necessary. There have been a number of studies that have been published looking at outcomes related to breast reconstruction and quality of life outcomes, and in almost every one of these studies, there is significant improvement in how patients feel about themselves, how they're able to get back into society and mix with their friends and family. There clearly is psychological benefit to doing immediate reconstruction. Now, if you choose to do delayed reconstruction, that doesn't mean that you have to live with a deformity for very long. It may be that you just need to get your treatments done, come back and do a delayed reconstruction, and the results can be almost as good as if it was done at the same time as the mastectomy. So some of the questions I like to have the patients ask me are things related to, what do you think is best for me based on what you're seeing? Do you think I'm a better candidate for an implant? Do you think I'm a better candidate for a flap? Or do you think I'm a better candidate for some sort of tissue rearrangement? This is going to be a process. It's not going to happen overnight. We are going to probably have 1 or 2 or 3 potential operations in order to get to that endpoint. Patients will often ask me, is there something else that I should read? Is there something that you would refer me to so I can gather more information or just kind of solidify what we've talked about?